Let's not sugarcoat it. This feels like another blow. The US Department of Education has proposed changes to how it defines professional degrees. Surprisingly and alarmingly, Master of Public Health and Doctor of Public Health degrees are not included in that definition. If finalized, this rule could reduce financial aid access and disqualify many public health graduates from federal benefits tied to professional credentials. This is not just some technical change, it's a message. And for many of us, it feels deeply personal. Here's what's happening, why it matters, and what you can do right now, whether you're in school, job hunting, or wondering if you made a mistake pursuing public health. What's actually happening? The Department of Education is proposing to redefine what counts as professional degrees. Professional degree categories are tied directly to loan limits and financial aid programs. In the past, this list included more than 2,000 degree types. The new proposal slashes that to fewer than 600 and removes public health entirely. Degrees excluded from it include public health, MPH, DRPH, nursing, MSN, DNP, social work, MSW, occupational therapy, audiology, physical therapy, speech language pathology. Under this rule, students in these fields would not qualify for the same borrowing terms as those in professional tracks like law, medicine, or dentistry. Instead, they'd be capped at the standard 20,500 per year federal unsubsidized loan limit, despite MPH programs averaging $30,000 to $70,000 in total cost. These changes make the pathway even harder. This is an attack on public health. Why this change feels so heavy? This proposal doesn't exist in a vacuum. This lands during a time when many students and graduates already feel disillusioned with public health. Here's the reality: burnout is rampant. 71% of state and local public health workers report symptoms of burnout. Funding is fragile. Pandemic era resources are drying up. Job prospects are shaky. Public health grads compete with global health and other health professional applicants for fewer roles. Trust in public health is eroding. Politicized attacks and misinformation threaten the legitimacy of the field. And now the federal government is signaling your work doesn't count the same. That message matters. It undermines prevention, health equity, and the vital public health systems that keep communities safe and healthy. Let's be clear: public health is essential. Public health is not behind the scenes. Public health may or not always make headlines like surgery or courtroom dramas because prevention isn't always sexy, but its impact is everywhere: violence prevention, vaccination campaigns, health equity and justice, safe water and sanitation, reduced maternal and infant mortality, climate resilience, and disaster response. These outcomes didn't happen by accident. They were built by public health professionals just like you. Supporters of the proposal argue that the new definition of professional degree should apply to programs that require licensure and a specific set of competencies leading to a narrowly defined occupation. Yet, because public health isn't narrowly licensed like law or dentistry, this proposal deems it not professional enough. That's not just short sighted, it's dangerous. Public health is interdisciplinary, systems focused, community rooted, and impact driven. The lack of a single licensure board isn't a weakness, it's a feature. What's at risk if this passes? This rule change says something loud. It implies prevention doesn't matter, upstream solutions are optional, community centered work isn't worth the same investment. But we know the truth: everyone wins when public health wins. For risk if this passes: loan forgiveness programs. Public service loan forgiveness may still apply, but students could be forced to take out higher interest private loans to cover tuition gaps. And these many times are very predatory. Reduced enrollment. Schools of public health may see declines in applicants, especially from underrepresented backgrounds. Workforce pathways collapse. A loss of funding access may mean fewer people choosing careers in vital but lower paid public health roles. Devaluation of the field at large. Symbolically, public health being excluded from the professional label sends a clear message: your contribution doesn't matter as much. And society pays the price when public health is sidelined. What you can do now: even if this proposal feels out of your hands, your voice and your plan still matter and are needed. So, one, understand the impact. If you're currently using or planning to use public service loan forgiveness, this rule could limit your eligibility. Connect with your school's financial aid office or use a trusted resource like studentaid.gov for updates. Check your current and future eligibility for public service loan forgiveness, federal direct loans, and any school based loan packages tied to professional status. Start at studentaid.gov or ask your financial aid office directly. Two, make your voice heard. Speak up before the window closes. The public comment period will be a time for you to raise your voice. You can leave a short personal statement here. Submit your comment on regulations.gov. I will link that below. Don't overthink it. Say why your MPH or DRPH matters, why prevention is professional, how this change hurts your ability to save communities. 3. Strengthen your advocacy muscle. Share this on your LinkedIn or with a friend or family. Start conversations with classmates and professors. Organize peer actions, petitions, or calls to elected officials. Email your department chair. Ask what your school is doing to push back. Remember, policy decisions can be shifted, but only when people show up. You're not just a student, you're a future leader. A quick plan moving forward. This moment is hard, but it's not hopeless. If you feel powerless, start here. Write your why, reflect on what brought you to public health, reaffirm your purpose, use your voice, post on LinkedIn or Instagram, talk to peers, bring this up in class. Awareness is the first step to action. Talk to your school, ask your department how they're advocating for students. Schools must show up too. Build your network, join communities or like minded people. Groups like our TPHM collective to support you. Link below. You're not alone in this. Be strategic, not just upset. Anger without direction burns out. Anger with action builds change. Remember, policy doesn't shift without pressure, and pressure builds when people show up loudly, consistently, and collectively. You belong in public health. You may be tired. You may be wondering if this degree was worth it. But let's be clear, you didn't choose public health because it was easy. You chose it because it matters. And no proposed rule can take that away from you. Let's advocate. Let's persist. Let's keep building what public health can be, with people like you leading the way. Drop a comment below if you resonate with this. Share this with a friend. Join our community. Let's come together and sign the ESPPH petition linked below. Take care of yourself. Take care of your friends. Peace, everyone.